What if I told you that medical cannabis could save the NHS just under £4 billion a year? The title isn't clickbait. This is some serious information. Okay? This is some serious information. Whether you love cannabis, whether you hate it, whether you're in between, whether you don't care, you do care about the NHS. You will at one point, and you have done at one point. And we all know it's the backbone of this country. It's understaffed, overworked, and anything that could give it a hand, especially saving it £4 billion a year, I think should be considered. Right, let's get straight into it. Don't want to mess about on this one. So, essentially, I did a lot of research. I will have the sources in the description. I did summarise it on ChatGPT because otherwise I'd just been reading through it for ages, and that's about it, really. So, yeah. Hello everyone and welcome back to Prescribed, the channel where I document my journey through the UK medical cannabis industry. It's my journey, but I try to provide information on how my system works. I'm trying to find out how people with other clinics works. I'm trying to spread awareness because, as I'm about to show you, there's not even close to enough knowledge about this. People are suffering and addicted unnecessarily to opiate painkillers. That's ridiculous. Now, let's get into it. Alright? What if I told you that the NHS could save £4 billion a year and all it needs is to prescribe weed or medical cannabis? Yeah, that's right. The same medical cannabis that's been legal since 2018. But nearly no one knows that they have access to it. Welcome to Britain, I guess. Stick around, because in the next few minutes I will show you how medical cannabis could literally save the NHS billions, and not only that, boost the economy, and still will somehow get buried in the most amount of paperwork and bureaucracy so thick that you could probably, I don't know, roll it up. Now listen, here's a serious bit, okay? I'm not making this up. This is, as I said, I'll cite my sources at the end. And this is just the summary of all the information. So I can't take you through every website. It'd just take too long. Okay, so you can read, but I'll read along with you. According to a 2024 report by the Cannabis Industry Council and Drug Science, CIC and Drug Science 2024, if the NHS prescribed medical cannabis to people with moderate to severe chronic pain, which is around 5.45 million people, it could save 3.97 billion with a B every year. It could save the NHS 3.97 billion every year. £4 billion. That's enough to fund thousands of nurses, rebuild hospitals, I was going to say something that could get me banned from YouTube, but I won't. But even like governmental benefits, like the tax on it, like they're just not thinking straight at all. So look, where do the savings come from? Where do you think? Less reliance on opioids. Reliance on opioids means addiction. Addiction means they need more medicine to get the same effect, to kill the same amount of pain, or they come out of hospital and end up doing the harder stuff because they can't get their hands on the painkillers anymore. So there's that. Now remember, it's not just chronic pain. This is just the first bit of this. And I don't have chronic pain, but my knee is in a lot of pain, and cannabis, certain strains of cannabis, helps it massively. So I am a half-walking example of what's going on here and what it can do. Now, so there's less reliance on opioids, therefore few GP appointments, fewer hospital visits, therefore more open beds. Because shocker, when patients aren't in constant agony, they don't need to keep coming back. And if they're on opiates, good chances are they will take more than you are telling them to take, doctor. And they run out of their prescription early, doctor. And their pain is back and they have withdrawals on top of it, doctor. So that's all good. That's what you want to be filling your time with. It's crazy. Let me take these off. It's too bright in here. I have to keep them on. But wait, it's get bigger. Gets bigger. If the NHS went further and expanded access for other conditions, like the private clinics do, conditions such as anxiety, sleep disorders, i.e. apnea, insomnia. Insomnia is the thing that it's a godsend to me for, I'll be honest. And neurological issues, fibromyalgia. There's so many different things that cannabis can treat. And no, I'm not saying it treats everyone the same way. I'm just saying it's an option that hardly anyone knows they have access to. So that's why I'm doing this. Now, the UK economy could see a boost of around 13.3 billion in gross value added over 10 years. And that is quoted from Curaleaf Clinic 2025. And that's not just money saved, that's money made. Because when people aren't sick or aren't in pain or aren't depressed or aren't anxious, they go back to work. They pay taxes and stop needing as many prescriptions. Like the doctor will give you pills for depression, but then you need to get other pills to add, like, for the side effect of those pills. You'll end up with tons of pills, and it's just, that's fine for some people. But I think people need to know there is another option out there. And also, like the amount of pills that the NHS hands out, like, yeah, we may get them free, but someone's paying for them somewhere. You got to think further than just yourself. So, yeah, people aren't in pain. They go back to work, pay taxes, stop needing as many prescriptions or sick notes. Who'd have thought it? Who would have thought it? Treating people properly helps the economy. Isn't that revolutionary? Now stay with me. In a minute, I'll show you why this still is not happening. And it's going to make your blood boil. So, if it's legal, effective, and cheaper, why are NHS prescriptions basically non-existent? Because, surprise, surprise, bureaucracy. Did you like my video yet? Did you subscribe? I'll just wait. Let's give you a sec to do it. Maybe you're still rolling up that bureaucracy, or rolling up something else. Hope you've done it. I trust you. Now, medical cannabis was legalized in 2018 as, well, anyone in the sort of bubble knows, but healthcare workers don't know about it. Police officers don't know about it. And that's from first-hand experience. I was told the other day that there's only 3 doctors in the UK that can prescribe THC-containing cannabis products. They must be some busy doctors if there's 80,000 patients. There's just such nonsense going around. Like, it costs tons. It is the product you get is not worth it. You have to jump through hoops, and you have to have like one of 2 conditions. And that's essentially, I think, because of the NHS. Like, that's how the NHS roll with their handing out of the healing herb. So, yeah. As with everything that everyone wants done, bureaucracy's in the way. Almost like, no, can't make that joke. I'm going to repeat myself. Medical cannabis was legalized in 2018, but NHS access is still rarer than a GP appointment that starts on time. Most patients, including me, well, 99% of patients, including me, have to go private and pay out of pocket. Now, luckily, I only pay for my medicine, like I would if I was. I mean, no one's gonna hand me free medicine, but that's why you got to be careful which clinic you choose. Okay, I'll always mention that. But anyway, don't go to the NHS unless you're trying to win the lottery. If you're trying to get a medical cannabis prescription, the NHS trusts say there's not enough evidence. NICE says it needs more clinical trials. And politicians say, well, none. Unless there's a photo op involved, obviously. They love it then. Basically, we're in this little weird limbo where medical cannabis is technically allowed but practically unavailable. And not unavailable because there's a lack of it. It's the lack of awareness. Okay? It's the lack of awareness. Do you really think people now knowing, like, we all have seen, like, what Kensington looks like. I mean, it's not so bad over here with the opiates, but do you really want to be risking getting addicted to opiate painkillers when you might think that's the best option for you? Everyone's mileage may vary, so I'm not medical advice. This is not. I'm just saying people should have the choice and the knowledge to make an informed decision if it is right for them. And although I did say paying out of pocket, there is some stuff. When I say paying out of pocket, the prices are coming down and some clinics are completely free. Whether you, if you, I think veterans get a deal, and I'm pretty sure the majority of clinics do a like if you're on any kind of benefits, child tax support, that kind of thing, ESA, Universal Job Seekers Allowance, they'll make it a hell of a lot cheaper for you. So there's that. Now back to the bad news. I'll repeat myself again. So yeah, we're in this little limbo where it's basically allowed. It is allowed, fully 100% legally allowed. But because no one knows about it, they don't have access to it. Like, again, I have first-hand experience of this. I used to go through days and days of insomnia at a time. That I can't remember that last time that happened. So it really has changed my quality of life. Again, it's not for everyone. However, it might be for you. So, I'm just giving this information out there. Even people who aren't considering getting anything to do with cannabis prescriptions, if you're interested in saving the backbone of our economy, the NHS, then this is something you should consider being probably a net positive, okay? If not, I just don't know what to tell you. I don't know what to tell you. So, let's recap. Medical cannabis could save the NHS nearly £4 billion per year. It could boost the UK economy by another 13 billion. It's legal, and yet barely anyone can get it on the NHS. 5 known cases. Sorry, I'm just thinking like what on earth they're thinking. Like, bureaucracy is the killer of all good things that I've come to realize in my life, I think. So yeah, if that sounds insane to you, congratulations, you've been paying attention. If you want to check the date yourself, I've linked the full reports from the Cannabis Industry Council, Drug Science and CEBR in the description, because unlike some headlines, we actually cite the sources here. So should the NHS finally start prescribing medical cannabis properly? Let me know what you think in the comments, especially if you've tried to access it yourself. If you've tried to access it yourself through the NHS, let me know what they said to you. And if you thought that was the end of the line for you being able to get prescribed the only medicine that can help you with your particular condition, it's not. The NHS are just making a mockery of themselves. Like, I don't know who's stopping this, like, from the top, but it's bureaucracy, and I think it's bad visuals to the people who view. No one's going to run a campaign on this, like, in terms of, you know, trying to win a general election. So we need to spread the awareness via social media. That's what I'm trying to do. Usually, as I said, I do a bit more, less serious videos than this. But I think everyone who is involved in the industry, from healthcare takers who work with people who've got a prescription, people who have a prescription, people who work in the NHS, people who love weed, people who hate weed, people who think it's a drug worse than opiates. Let me know all your thoughts. And it took me hours to make this. I know it's all summarised here, but take 2 seconds, give me a like and a subscribe. Would really, really appreciate it. Big up all of you. If you want more videos that mix facts, a bit of satire, maybe mild frustration at the state of UK healthcare, hit like, hit subscribe, and tap that bell, all that good stuff, so you don't miss the next one. I think I might put this in a separate playlist, because this is a slightly different video, but it'll still just be there with all the rest of my videos. So right, just some quick ones before we go. So this is from the Pharmaceutical Journal. Just a quote: "The legislation did not open broad NHS access in practice." And I'm talking about the 2018 legislation of making it legal. A key review and article note that although the law changed in 2018, NHS prescribing has been extremely limited. For example, an article reports that since legislation, fewer than 5 NHS scripts per month for unlicensed CBPMs, cannabis-based medicines, have been dispensed by the NHS. Meanwhile, the private sector has become the main route for many patients, including myself. Private clinics specialising in medical cannabis are proliferating. Studies show a large latent demand. One review mentions that before and after legislation, many patients were self-medicating with illicit cannabis-based products. Same as I was until I realised I hated it and stopped using it for so long, because all that was handed around here was Ami this, Ami that, back those days. And when I was trying to get to sleep, it made my mind race. And I went to Amsterdam for the first time when I was younger, and when I could choose what I wanted, like, I never got the unpleasant feelings. And that's the problem with street stuff. You don't know what you're getting. Your dealer probably doesn't know what he has unless you've got the real plug. You know, it's mids put into fake packs half the time. If you're spending £60-70 on 3.5, good chance it could just be mids put in a. You can buy these knockoff, for instance, like any strain in these shops in London. They just have the bags, exact copy of the graphics on the bags and everything. So just some numbers for you. The 2023 article, Demystifying Medical Cannabis. That's what I'm trying to do here. The Pharmaceutical Journal reported that more than 140,000 prescription items for unlicensed still cannabis-based medicines were dispensed between November 2018 and November 2022 via private prescription. That is in a case of 4 years since it became legal, and that's around 31,000 patients estimated to be accessing such care privately. On the evidence base, while there are some RCTs for specific indications, like, for example, Epidiolex for certain epilepsy syndromes, for many conditions, the high-quality randomized controlled trial evidence remains limited. Although you mentioned chronic pain and opioid substitution, the formal approval and guidance for CBPMs for chronic pain is very limited in the UK. The NICE guidance is quite restrictive. Now, Big Pharma, anyone? I know we don't have to pay unless we go private for other, like Bupa, that kind of thing. But we have the NHS, one of the good things of this country. But it's in dire need of some $4 billion a year. That could seriously help it, Now here's some barriers, okay? Because I didn't want to make this all sound like sunshine and rainbows, because as we know in this country, who was surprised when it even became legal for medical cannabis in 2018? I didn't know then. I've only known for just over a year. Shout out Drew is sharing. And congrats on that coffee shop and living in Thailand. Best place in the world in my opinion. Been there for a couple of months, twice, 1 month each. A lovely place, you can live like a king for nothing. I haven't been since the weed's been legal there though. So I wonder how it's changed. I imagine quite a lot. Anyway, a major barrier to the NHS prescribing cannabis is specialist doctors are required. GPs generally cannot prescribe cannabis-based medications except via referral. Insurance indemnity, regulatory caution, lack of a clear evidence base all deter prescribing. And that is from the Medical Cannabis Clinicians Society. Awareness among both patients and clinicians is low. One article notes that many patients are unaware that medical cannabis is even legal. This is what I'm saying. Awareness in both patients and clinicians is low. Many patients unaware that medical cannabis is legal or accessible via private prescription, because just because the GPs and hospitals and that can't prescribe it, they don't suggest it, because how does that help them, you know? Like, there's so much evidence that it's helpful in so many ways. So you've made it legal, so you know the truth. Just use some of that money that you could save and just let the NHS prescribe the damn medicine that people need. Just do it. Please, will you? Just do it. No, my mic's gone, unfortunately. That sucks. So I'm sorry if the volume changed a little bit during that. I should really be over here, shouldn't I? No, not that. So, yeah. Want to know some barriers? That's one of them. Awareness among both patients and clinicians low. Stigma and regulatory caution also play a role. The stigma is another thing I'm trying to, with awareness, lower stigma. With information, with education, lower stigma. So that's the aim of this. The historical classification of cannabis, the fact that many products are unlicensed and certainly over long-term outcomes, means some prescribers remain cautious. And of course, the information gap. Online information sometimes overstates benefits or downplays the side effects or regulatory caveats. A study of online medical cannabis information found that only 22% of web pages mentioned potential side effects, and many therapeutic claims exceeded the evidence. Now, that is from ARXIV. Don't actually know what that is. And I agree. I hate propaganda, and I'm not trying to propagandize myself. As I said, this is all my journey and information that I find out that I think people would be interested in. Should the NHS save $4 billion a year? That's a no-brainer, an absolute no-brainer. But I don't think that it should be there are side effects, obviously, like with any medication. Take it in moderation. It's not addictive to anywhere near the levels of the pills that they will try and put you on at the hospital, the doctor, the GP. It's it's become sort of a cool thing recently. And just because it helps with a lot of my conditions, I've never said I don't enjoy the feeling of it, but that's irrelevant. If I was to take a morphine pill, probably cure my pain, and I'd also enjoy the feeling of it. How can anyone be against cannabis for medicinal uses, but for the use of extremely strong, addictive, life-ruining, family-destroying opiates? People are on the street now, hunched over on that fent, because all the pill mills, they were just going in, getting prescriptions easy back in the day for real M30s, you know the ones. And then they figured that out, the prescriptions stopped, and that wasn't just the pill mills. Doctors were all over the place, were handing strong like oxycodone, oxycontin out, and then they had to stop the prescriptions, and by then people weren't in a position to stop unless they were willing to go through agony. So what do? They want to get rid of that pain. What do? You know exactly what they do. Not all extreme is Kensington in Philly. However, people don't like opiate withdrawals, so they will go to the street, pay through the nose for pills. And nowadays, if you are in America and you're, every time you do a pill, it's you're not getting the real street opiates that you were once getting. Okay, you're just not. Everyone knows this. People didn't used to be nodding out on the street, and it's sad to see. San Francisco is a lovely city. It's now, I haven't been there since, but it's not looking good from what I've seen. Now, yeah, the private clinics fill a massively important access gap, but patients must still meet criteria. I get that, because otherwise it could just turn into like a pill mill type situation, because no one can gauge another person's pain. You go in and say, I broke my back, I fell off a ladder at work. Oh, here's 80 milligram oxycontin, taken twice a day. That's an American example, but I think it is, it's essentially to stop, drug seeking. I mean, it's obvious, isn't it? But if you've had a condition for years, you will probably have tried at least 2 types of medication or treatment to get rid of it. Right? Like, why would you, the likelihood is, if you're watching this, you have had a condition and you have tried things that have either worked and then stopped working, or didn't work, or whatever. So, I mean, that's literally the only thing that you need to meet, the only criteria you need to meet. So all these loopholes you have to jump through, not many of them. There's 2. There's one split into 2. Have you got a condition? Have you tried 2 treatments for it? Now you have access to medicinal cannabis. That might not work for you, but at least you know it's a bloody well good option if the others haven't. Yeah? And if it doesn't work for you, it might work for someone else in a similar condition to you. Or if you know someone who self-medicates, tell them to go the legal route. Because all the nonsense that it's impossible to get is all just because of the NHS having only 5 known prescriptions so far up to this year. So, oh yeah, and there's clinics doing it basically free now. Like, it used to cost, it did when it first started, used to cost a lot, but now it's great because there's more and more clinics opening up. More competition means less monopoly. Less monopoly means price competition. Prices are coming down to the point of the clinics doing everything free apart from they're not sending you free medicine, but you won't have to pay for anything else. And you certainly don't have to pay monthly. That's something I would avoid personally, but if the clinic looks right for you and you have to pay monthly, then you do you. I'm not giving any advice. So that is about it, really. I mean, I've got some things here, some research questions. What is the cost range for private medical cannabis consultations depending in the UK? For chronic pain specifically, what evidence exists comparing cannabis medicine versus opiates and other pain meds? What the real world patient outcome data, quality of life, opioid reduction, side effects from UK private clinics? What regulatory or policy changes are being proposed to expand NHS access, expand the NHS's mind? They'll need to go and take a trip. A team building trip. You know, they're overworked, understaffed, but they need to expand their mind. So yeah, I'm gonna look into all of these. So, what regulatory or policy changes are being proposed or could be to expand the NHS access or allow GPs to prescribe? I can't see the GPs ever being able to prescribe, unfortunately. But now it really is a case of you just, like, when there's free clinics, and if you're gonna buy weed anyway and self-medicate with it, wouldn't you prefer to know exactly what you get? Probably pay less for better quality medicine? Because I'm telling you now that I don't think one of the strains of medicine that I've received since I became a patient has been, if I got that on the street, I'd be extremely happy, you know? These are proper business growers. They're not just trying to get that flower out there and make as much money from it as quickly as possible. No, that's not how they're doing it. Anyway, so look, there's a lot of questions about it, which I think I might do a little bit of a follow-up to this video. I might split this video in half. But that's about it. if you want a TLDR, since 2018, medical cannabis has been legal to prescribe in the UK under certain conditions, and that is from the medical cannabis. That's from the NHS. Despite legislation, actual prescribing via the NHS remains extremely limited. clinicaltrialsarena.com. A health economic model commissioned by Drug Science and Cannabis Industry Council found that prescribing medical cannabis for moderately or severely disabled chronic pain sufferers could save £729 per patient per year on NHS costs due to fewer prescriptions, fewer hospital GP visits, and a lack of addiction. If applied to an estimated 5.5, rounded up, million people in the UK with that level of disabling chronic pain, the model projects just under $4 billion in annual NHS savings. When also counting productivity gains, which is less time off work, higher earnings, the economic benefit was estimated at £1,037 per patient, rising the total to £5.45 billion per year in potential UK economic benefit. I'm highlighting all the sources that it has compiled this from. The model authors argue that medical cannabis could meet the cost-effectiveness test used by the National Institute for Health and Care Excellence, which we know as NICE, in the UK. I'll say that again. The model authors argue that medical cannabis could meet the cost-effectiveness test used by NICE in the UK, which means, i.e., it's good value for money, under their assumption. There is also evidence reviewed in academic literature that cannabis-based medicines may reduce hospital stay length, as I said earlier, more space in the hospital, reduce use of other medicines, again, especially in pain context, but also in antidepressants, anti-anxiety, benzos, extremely addictive, which suggests additional savings potentials for the NHS. So yeah, that's about it. I thought you might find this interesting. It's a bit of a different one today. It's not a review, it's not necessarily uplifting, especially if you watched to the end. If you did, I love you. But whether you love it or hate it, 5 billion, 4 billion saved by the NHS annually if they would just prescribe medical cannabis instead of highly addictive opiates. But unless we're all stupid, we know why they prefer addictive opiates. Because as much as they say they're overworked, health is a business. If everyone was healthy all the time, too long for this video, but it's always money thing, basically. And right, so this one all about, could medical cannabis save the NHS billions per year? The answer, yes. Are they going to do it? Likely no. Not in any time soon. And doesn't that just make you want to medicate? So yeah, I think this will be a little series on important information within the industry. I believe that it's information like that. It doesn't shock me, but it shocks me. You know, I didn't realize it'd be anywhere near that much. I've always I've always thought it's shocking that, knowing the benefits, that they just refuse to accept them. And when it is made legal, it's private, so you have to pay for it. But be honest, before you saw my first video or someone else's first video on here about UK medical cannabis, did you know about it? Because I'm damn sure, I know I didn't. I didn't know about it. I was shocked. I guess it's because I hadn't been following the industry for years. Like, basically, I went through uni. Like, I remember, like, I stopped just after school, and it was 3-5-20 every time. Then I went to uni, and my mate was connoisseur of the herbal, and I asked him. I couldn't get to sleep, so I just thought, try it. I missed the whole. When did it go from 3-5-20 to 10 for a G? Like, when did that all change? That was how I felt back then. But, you know, it is what it is. Everything gets more expensive. And yeah, that's about it from me today. Please, just for the effort I've put into this one, and my willingness to look silly and serious at the same time, just give me a like, give me a subscribe, and when we get to 50 subscribers, it's on video, so it will not happen. 50 subscribers is my next milestone. We're just over halfway there. To anyone who has subbed, thank you so much. Really appreciate it. But yeah, 50 subscribers, I will be doing a giveaway. Not a big one, but there'll be milestones in terms of subscribers, and the prizes will get good. But you'll have to watch to the end of the videos, or somewhere in the middle of the video, because you're gonna have to know the code or the number that appears on the screen for a couple of seconds at one point during a video, to be available to get. It'll just be something like a, I don't know, a Raw t-shirt, a Dank of England t-shirt, I don't know, a t-shirt, a cool grinder. I don't know. Haven't thought too much about it yet. I've been hours deep in this. I've been going at this since this. I need to medicate now, and I have not medicated yet. As you can see, totally wiped eyes. I don't lie. I use it to go to sleep, but I need it to relax right now. And it is 20 to 11. So, yeah. Now is about the right time for me to go and medicate and fall into a nice deep sleep. If I can, after hearing all that nonsense that I've just had to give you. All true, but truth can be nonsense too. If you have any questions, any thoughts, if you think I've got anything wrong, I'm always open to people telling me that. Matt, Trees, you did this wrong. You missed this point. Could have said that better. It's constructive criticism. And I'd like to think the people on this kind of channel are not the kind of people who will be dicks for the sake of being dicks. That's not a challenge, but I think we're all cool in this kind of community, which I hope to grow. I want a community of like-minded people interested in the industry, and just I want to find out how a prescription would help you, how yours has helped you since you've got one. If you were one of the 5 people who've been prescribed a cannabis product by the NHS and you somehow see this, please tell me. You don't have to give me a name or anything like that. Just comment down below, and if it's not you, don't say it's you, but if you are one of the 5 known cases that the NHS has prescribed cannabis to, I would love to know what kind of product it was. Did it work? And how do you feel about the current state of the NHS's unwillingness to budge on this topic? And how do you feel about having to go private, even though it's basically free now, or costs have come down now, and the product is coming up now. I have a very, very special video coming up, much less serious. Blue lobster! Why did I just say that? Is it because I got a blue hat on? No. By a company called Vasco, by the way. It's 27%, about my favourite. Jesus Christ, can't show you that. Am I big? Am I big anyway? Yeah, I'm big anyway. Let me see if I can show you that. So it's a strain that if you were one of two people who saw my unedited version of how patients will have to go about ordering their medicine after they get their prescription, you will see that I ordered a interesting named strain called Blue Lobster. It's a hybrid leaning indica 60-40 in many sources, and its mother and daddy is apples and bananas and eye candy. Typical THC content reports vary, commonly quoted between 26 and 30, so that would make the claim of 27 about right, because there is a 10% leeway, I believe. So if it's 12%, they could say it's 13.1%. No, is that correct? 12%. So you got 10%. Yeah. So yeah, 13 point. Yeah, you know what I'm talking about. If something's 10%, they can say it's like, if something's averaging out to be 10%, some 9, some are 11, some are 8. The claim they make has to be 10% either way. Right? I've been at this too long. My brain isn't working. I've said it on another video. So, for example, I'll do it with 30. Say a strain claims 30%. Yeah? We all know it's probably not 30%. However, 10% of 30 is 3. So it could be 27. Or it could be 33. But they're not going to lie the other way, are they? They're going to... If something's... But then I guess if it's actually 27, they can only say it's... Yeah, they can say it's about 30. Yeah. They can say it's about 30. Just under. Anyway, I'm just rambling on here. And I don't want to give too much away about the old Blue Lobster. Yeah. been an interesting one today. Sorry about the sort of just reading things to you, but the amount of information that I took in, if I didn't get it summarized, I wouldn't be able to get through anywhere near all of it. I have graphs, like I'll see if I can find the graphs. Don't ban me for that, please. That was just an accident. Right, so maybe I'll do this as a short. Yeah, that's it. I'll do this as a short. I've got a graph. I've got a few graphs. Pictures say more than 1,000 words, and I can't be bothered to speak one more right now. Apart from to say, anyone who's still watching, I love you. All my subscribers. And as always, have a great evening, morning, afternoon, whenever you're watching this, wherever you're watching this. This is Prescribed, and this is Trees signing out. Trees out. Peace out.